for a little bit. Okay, it's recording now.
Okay. Okay, Ace Whale, good day everyone and welcome. Thank you very much for taking the time to tune into this mini webinar. This webinar is for the purposes of COVID vaccination in Indigenous communities, prepared by myself and my friend and colleague. So I'll throw it over to Marissa to introduce herself.
Hello everyone, my name is Marissa McIntyre and I am the cultural safety educator. And my traditional name is Kinechko, and thank you for being here today and being present.
And hello, my name is Len Pierre. My ancestral name is Palikulak, and I am Coast Salish from Keetsi First Nation, and I am the cultural safety consultant for Indigenous cultural safety and humility at Fraser Health.
So we're just going to get into a quick overview of today's webinar session. We're first going to go into Fraser Health's commitment to cultural safety. And then after that, we're going to move into the Indigenous population in the Fraser Salish region. After that, we're going to go into some cultural protocols when you visit the community, some things that might come up. And then after that, we're going to get into a little bit of vaccine hesitancy in First Nations communities and where there may be some sort of resistance or distrust. And then finally, we're going to go into Indigenous community engagement guidelines.
So to further ground our conversation, a big part of the work that we are doing, given, the very important work that each and every one of you have for rolling out the vaccine and administering vaccine to Indigenous communities within the Fraser Salish region. All the while, we do want to stay grounded in our original commitment at Fraser Health. Way back in 2015, Fraser Health signed a declaration of commitment to advance and embed Indigenous cultural safety and humility into everything that makes up our programs and our services in our health authority. So defining cultural safety is really an outcome based on respectful engagement that recognizes and strives to address power imbalances inherent in our healthcare system. It results in an environment free of racism and discrimination where people feel safe when receiving healthcare. Cultural humility is a process of self-reflection to understand personal and systemic biases, and to develop and maintain respectful processes and relationships based on mutual trust. Cultural humility involves humbly acknowledging oneself as a learner when it comes to understanding another person's experience.
So we're just going to get into some statistics for reference for the Indigenous people in the Fraser Salish region. We have 62,000 self-identified Indigenous peoples in this area. 56% of those people identify as First Nations. 40.5% of those people identify as Métis. And 0.5% identify as Inuit. 32 First Nations communities are on these lovely lands. We have 6 Métis chartered communities, 2 friendship centers, and that's it.
So now we're going to kind of cover a couple of cultural protocols when we visit community. And so this is, really emphasizing that how we mobilize cultural safety and cultural humility within any professional practice is kind of understanding having some cultural awareness for when we are walking into those communities. We like to call it visiting. When we go to visit the patients and the clients and the families that we serve. So there are some cultural differences that we might encounter within a corporate or clinical setting, like our clinical offices or clinics, or any of our Fraser Health sites. There might be some cultural differences for when we are working and engaging with Indigenous peoples in their own communities. One of the things that we like to reflect upon and encourage all of our colleagues to think about is a humble approach and attitude when we are visiting Indigenous communities. So humble approaches and attitudes is in the way we kind of show up to this work. So when we're visiting a community that we don't belong to, it's really exercising and putting our professional ego aside and making sure that our language, our tone, our sense of time, and our sense of pace really is humble, and that we are respecting the community in which we are visiting. And then, of course, we do like to, talk a little bit about cultural awareness for communication. Every culture, on the planet does have different value systems and different norms for how we communicate to one another. So within our First Nations, and from my own cultural background of being Coast Salish, and for many Indigenous communities, we do have a style and a value system for communication that is listening before talking, being very attentive and observant. And of course, not always making eye contact, because eye contact can be, deemed as culturally inappropriate, in that somebody is challenging you if they're making too much eye contact. But for us, is as service providers, sometimes interpret that as somebody who wants to kind of disengage or is uncomfortable with our process. So we just like to encourage that, the communication behaviors or patterns that you might see when you're visiting community might just be a little bit different than what we're normally accustomed to within a clinical setting. Our family systems are quite different, meaning that we have quite an extended network of families and blended families. And then we also have various means of traditional and cultural healing practices that we might like to kind of bring about or ask about in our when we're receiving care from healthcare providers. And we'll have resources for you at the end of the slide here, the slide deck here. We do like to encourage anybody who is visiting Indigenous communities of off-reserve families and being mindful about off-reserve families and on-reserve families. And that's largely due to the fact that, not all of our Indigenous patients will be residing within on-reserve. And sometimes might be coming in from off-reserve as well. So just to be aware of that dynamic. And if there is a political dynamic within vaccine rollout in a specific community, the power and autonomy for deciding who gets that vaccine resonates with the leadership and the clinical leaders of that community.
There could be some hesitancy in the First Nations communities just due to vaccine history and the recent and not so recent history with Canada. One of those things could be health literacy levels. There is a lot of misconception out there right now about this vaccine and about how it's being handled, and that may make its way to the minds of some people. So that's something to keep in mind. There are also historical implications of previous colonial traumas and experimentation. This is something that we cover in Indigenous Cultural Safety 101. If you've taken that, you will know the references that we're discussing. Previous disease experiences within Canada and with our Indigenous peoples. And systemic power imbalances. So with that comes mistrust of the system and institutional mistrust. So these are all some things to consider on where these First Nations communities are coming from, with any regard to hesitancy or just a little bit of pushback.
When it comes to community engagement guidelines for when we are visiting and working in community, here are some cultural safety strategies that we like to emphasize. The first being a compassion-centered care. So just think for a moment and reflect to yourself, what is compassion-centered care and what can you mobilize within your own professional practice to really center compassion at the heart of it? Is it your voice? Is it the language you use? Is it, lowering yourself so that you're not hovering over anybody? Is it being patient and taking the time with the person that you're providing care to? Number two, just really, and this is message that feedback that we get from community all the time, is just for us as healthcare providers and healthcare leaders to slow it down and listen to the community. So, our elders always have a cultural teaching that they give to us all the time in community as young people. And that's to always remember to listen twice as much as you speak. So there's a reason we have 2 ears and 1 mouth, so that we listen twice as often as we speak. And this is a real incredible value for when we're visiting communities, and honor that humble approach. And then the fourth point is humility means that you leave your professional ego at the front gate. So many of our First Nations communities have been policing since the very first wave, and a lot of First Nations communities have put up gates at the front entrance towards their communities. So it's just important. We have a cultural teaching in our cultural practices too, where we are taught that there's an invisible nail hanging outside of our homes, and when we're visiting a home that is not ours, that we take off, all of our negative thoughts and our ideas and our negative emotions, and we hang it on that nail before we walk into that person's home, so that we don't bring that energy to folks. So we just would like to invite you to think about that if you are, coming from a place of, high intensity regarding work, working in a crisis, a dual health crisis. There's so much on the go. We want to make sure that you are protected at the same time, and not, going into something that you're not prepared for, which is why we're also creating this mini webinar for all of you. But also just reminding ourselves always that humility means that we leave our professional egos at the front gate. And then, of course, our elders tell us time and time again that our approach really is to exercise empathy over efficiency. We know there's a crisis. We know that tensions are high. We know that there's fear and anger and resentment right now in all of the communities that we serve. But and we have a schedule to abide by, but within a trauma and resiliency informed practice and within cultural safety, we do want to make sure that empathy is put before efficiency moving forward.
So we have some further resources or other teachings for you to access at your own time. We have Indigenous cultural protocols that are available on Pulse. You can just search that up. We have cultural safety education on the Learning Hub. We have community engagement guidelines through a PDF and a video. And both of us are here to help. So if you have taken our courses, or you've taken Indigenous Cultural Safety 101 or Two-Eyed Seeing with Jordan White, and you have any other questions, or you just have questions about getting into those courses in general, feel free to email both of us. Maybe just me, but yes, thank you so much, Coach Stem.
Hi, Chika. Thank you, everybody.